It's time to get rid of your inflammation fast. You know, that swelling, the pain, the inflammatory process that you're feeling in your body. Now, it may be localized. It may be something that you've only experienced for a short time frame. In this video, I want to talk more about the chronic inflammation that goes on in the body that can actually damage DNA and affect cancer cells, affect heart disease, obesity, diabetes, all of the chronic situations that low grade or even high grade inflammation can lead to throughout the years. Now, if you've ever been diagnosed with any sort of itis in the body, like colitis, rheumatoid arthritis, tendinitis, gingivitis, all that means is inflammation, and inflammation in a localized area. So the more acute situations, just say you sprain your ankle, you trip over your foot, the tendon there is strained or sprained, and your immune system is so smart that it's going to send out all the troops to that area, which can cause more swelling, redness, heat, and pain to that specific area. Now, in an acute situation, that's a very healthy, normal process as far as how your body is repairing itself and healing. Now, when it becomes a problem is when that lasts for over 6 weeks, goes on to months and even years of inflammation. Now, in this video, I'm going to talk about the top 3 things that you need to know to lower that inflammation process and allow your body to heal. Now, number 1 is, why is there inflammation there in the first place? So just taking a painkiller or a Tylenol, Advil, things that lower inflammation acutely, that is not addressing the root cause of why the inflammation is there in the first place. So the first thing that comes to mind is an injury. So if you are athletic and you're constantly playing tennis or golf or using the same joint again and again, then that area and the overuse of that joint will create a low-grade inflammatory response over the years, leading to arthritis. So using different joints, putting ice on it to help with how your body is healing will help with more of the injuries that we know are causing the inflammation there. Now, the second one is if you have an infection. So even if it's a low-grade infection that sit in the small intestine, that can be there for years and years and years. Even the large intestine too. There's cells called Peyer's patches, which hold on to this bacteria chronically throughout your life, creating more of a low-grade inflammatory response. So if you've ever been diagnosed with colitis or irritable bowel syndrome or anything signifying inflammation in the gut, you always want to ask why. You want to know what is the bacteria or virus or yeast, mold, what is going on in the gut that is creating this inflammation. There's a stool test that I like to do in my clinic where we actually take a sample of your stool, we send that away. This sample of stool test can actually tell you if there is a low-grade inflammatory response caused by Epstein-Barr virus, by E. coli, Shigella, any type of acute situation, but then the ones that are harder to detect, even like Epstein-Barr virus, H. pylori, any infection that can kind of distract your immune system from focusing on bigger things like abnormal cancer cells. So if we have this low-grade inflammation, you want to know why. Is there an infection going on in the system that we need more antibacterials or antivirals, things that are more targeted in on the root cause of why that inflammation is there? The other sneaky area in the body that can create inflammation is if you have any bacteria in the mouth or in any cavitations in the gum. So for example, if you ever had a root canal, it's very easy for bacteria to get trapped in the cavitation there and can create more of an inflammatory response in your system. So if you are not seeing a dental or a holistic dentist regularly, that's something that I would highly recommend, just to make sure that anything that's in the mouth, it's so close to your nervous system and it affects the blood-brain barrier. It can affect your whole body and how it deals with inflammation. Seeing a dentist can also help with understanding, is there bacteria going on in the mouth that can actually have a whole body inflammatory response? Now, the third one that's really important when it comes to root cause of why the inflammation is there is taking a look at your diet. Now I have a lot of videos on this looking at which foods are pro-inflammatory and which ones are anti-inflammatory. So you could live a very stressful life and have a lot of things on the go, but if you're adding in things that are very acidic, deep fried, a lot of sugars, alcohol, then you're gonna have a whole systemic inflammatory pathway there. So we need to address that and look at your diet and say, okay, am I really having the foods that help bring down inflammation on a regular basis? Now, the second thing that you need to know when it comes to bringing down inflammation fast is which lab markers to check. It's a really good idea before you start changing anything in your diet or in supplements that you're taking, even with medications, get a baseline of what your inflammation looks like now. When looking at blood work, there's a few markers that are often missed when you're getting your conventional labs done regularly. So the top ones that I want you to check is ESR, high sensitivity C-reactive protein, and lactate dehydrogenase. Those are three things that you can check on a regular basis before you start to adjust anything in your plan. So for example, I did my own blood work because I wanted to see how inflamed is my body. I mean, I feel great. A lot of times you don't feel inflamed. Sometimes you can just be really busy and maybe following the wrong diet and show high inflammation markers. And that was exactly the case for me. I started to switch around my diet. I was doing HIIT training. I was doing more of a keto style diet where it's high fats, moderate protein, and really low carb. When I did my blood work, my ESR was through the roof. My high sensitivity C-reactive protein was also through the roof, which made me wonder, is that actually the best thing for me? So I started to scale back on the fats and I started to incorporate more stretching and rebounding, things that just aren't so labor intensive and inflaming to my body. And a month later, I saw all of those blood markers cut in half. So your body is constantly changing and it's very forgiving. So it's a good way to monitor what's going on in your system when you don't necessarily have symptoms. I had 0 symptoms that my inflammation markers were high. So when you are doing any type of lifestyle change, it's a really good idea to monitor inflammation on a monthly basis until those levels get exactly where they should be. So high sensitivity C-reactive protein, I like that level to be under 1. ESR, they say that the levels between 0 and 30 is ideal. I also like that level under 10. We're going for optimal here, not just for the average range that the general population strives for. We want you feeling great, and especially after any kind of chemotherapy, radiation, any medication that you're on that can create more inflammation in the system, we want to monitor that and have those levels so optimal. Now, if you see your C-reactive protein high and your ESR high, what that can do is lead to drug resistance. So it's a very important marker even when it comes to how you respond to conventional care. So if your levels are within optimal, what that means is your system will respond better to these meds without having to switch it up and without having to increase the dose over time. Some other lab markers that I like to check, not necessarily on a monthly basis, but maybe every 3 months, is hemoglobin A1C. That's looking at how your body deals with sugars. We know that if you don't deal with sugar well, that can create more inflammation in the system. The other important one is looking at your ferritin. Your ferritin is your stored iron. So in any inflammatory situation in the body, your body's going to hold on to more iron, and that will signify more of an inflamed system. So cancer cells love iron, for example, so you can see your ferritin levels skyrocket when there's an active cancer going on. Also, bacterial infections. Bacteria loves iron. So that's another sign that your system is inflamed. So just to recap, the top lab markers that I like to check: high sensitivity CRP, lactate dehydrogenase, which is more of a cell breakdown in the system. So with advanced cancers, you can have high lactate dehydrogenase, and that's a good way to monitor in between imaging, just to make sure that we're keeping things under control. We want that level to be under 190. I know in the conventional model, they say under 220 is where you want to be, but we want optimal here. Lactate dehydrogenase, high sensitivity CRP, ESR, ferritin, and hemoglobin A1C. Those are the top 5 labs that I would monitor every 1 to 3 months until they are in the optimal ranges. Now, the most valuable part of this video is coming up, where I want to talk about the things that you can do to bring down the inflammation once you've already set the baseline of how inflamed you are and we've discovered what the root cause of the inflammation is. If you haven't already downloaded my free book, drlori.ca, make sure you go access that now, where I talk about the top 160 ways that you can boost your health and beat cancer on a daily basis. You can also access my top-selling book, Live Longer and Stronger with Breast Cancer, by going to drlori.ca. Now, one thing that I find really interesting about healing and the body rejuvenating and dealing with this inflammation is that intuitively it always knows what to do. And we've been told by the medical system or been told by our loved ones that you need to suppress this inflammation. So take a Tylenol if you have a headache. Take this medication to suppress the symptom because we don't want to feel in pain, which is very true. But sometimes we need to experience certain inflamed symptoms in order for our body to do what it needs to do. So a good example of this is when I was feeling sick recently, when I had COVID. I had no appetite. I just felt like I wanted to rest, relax. I didn't want to eat. Whereas other people, when they have COVID, they're told you need to eat something because you need to keep your energy up and you need that fuel and you need to be supplying your body with all these things. But that's not necessarily true. So if you feel like fasting is one of the best ways that your body can start cleaning up old dead cells known as autophagy and start regenerating healthy new ones. So fasting is my top way to help bring down inflammation. You can also look into just having bone broths or going on a fasting mimicking plan where it's under 500 or under 800 calories a day, where you're getting the minerals that you need, the amino acids that you need, and lots of water. So allowing your body to rest and rejuvenate is the top way to bring down inflammation. Now, if you check your blood work and you see very high ferritin, this is something that you can address by incorporating black tea with your meals. So high ferritin means that you have too much iron, and black tea is a chelating agent for iron. So it acts as a binder to help remove the excess iron. So that's something that you can add in with every meal, having a small amount of black tea just to make sure that you're not accumulating more iron in the plan. Another very successful therapy that you can do for high ferritin. So just say you're getting joint pains and you're feeling tired and inflamed and you know it's because of this high ferritin, you can ask your doctor about blood dumping. So that's donating at least 300 milliliters of blood to help bring down that inflammation process. You know, when I was in Germany visiting the integrative hospitals there, what they did for high ferritin and for inflammation was using leech therapy. That's right, they used leeches as a medical device. They had a DIN number, it was a drug that they helped people with bringing down this acute inflammatory response. So these leeches release proteolytic enzymes, which has an anti-inflammatory effect on the body. And it was really interesting too, because they would just say put the leech on the knee where it tended to be more inflamed. And if the leech could sense that the patient was scared or nervous, it wouldn't suck out whatever it needed to do. It wouldn't have the effect and the healing effect on the body. So these patients were told to remain very calm so the leeches can help support the body without going into, I guess, fight or flight mode. So it's very interesting. I had no idea that leeches even had this superpower of sensing when the person is scared. And this isn't something that I want you to go into your own backyard and find a leech. This is a medical grade leech that they use for the healing process. Another great way to bring down inflammation if you're not into applying leeches to your system is going into a sauna. So sweating is a very effective way to bring down inflammation because it helps heat up your body, releases heat shock proteins, which can address any kind of bacterial, viral infection, any kind of pathogen in the system can be addressed with excess heat. So going into more of a hyperthermia state, allowing your body to use that heat to kill off infections that could be the root cause of inflammation. I always like to alternate with cold showers as well. So the contrast showers, so spending 20 minutes in a hot sauna and then doing a 30-second freezing cold shower will help get your lymphatic system moving and act as a drainage to get rid of things that may be stagnant and creating more inflammation. So if this is something that if you don't have a sauna at home, then you can do this in your own shower where you go 30 seconds, 40 seconds of high heat, and then scream if you need to and do 20 seconds of extremely cold throughout the body. You can alternate that, so go hot, cold, and you want to end on cold. I find that's a very effective way to get lymph moving, but also to really supercharge your system. I find I'm very energized when I do that. I try to do that at least 3 times a week, if not every day that I'm in the shower. For more localized inflammation in the body, so just say you feel inflamed just in the gut, or you feel a joint has flared up, or anywhere that you're feeling that pain and redness and inflammation, you can apply castor oil. Make sure you get the cold pressed hexane-free castor oil that comes in a glass jar. That you can apply topically and to any area where you feel inflamed. It acts as an anti-inflammatory. You can put on the area for about 20 minutes every single night. It's very gentle and it'll slowly help your body heal. If you're taking a lot of medications, you can also apply the castor oil over your liver, and your liver will be supported in how it should be detoxing regularly. It's a very safe and gentle way to support what your body should be doing naturally. So getting castor oil, you don't need a lot of it. It's very thick, and so you can just apply a little bit under the right rib where your liver is, and that will help your body heal over time. I hope all this information helped. Remember to download my book to get more ways on how you can reduce inflammation fast.